I'll let my co-host make the call. Bruce and Mel, what do you think? Should we get started?
Yes.
Yeah, I think let's get started.
All right. We're gonna get started. So thank you everybody for taking the time to join us this afternoon. My name is Neha Singh. I'm the CEO of PACE. And today with me I have
Bruce Drake, Manager of Special Projects at Pioneer Manor.
And Melanie Morey, President CEO of StaffStat.
Awesome. And we'll talk a little bit more about the team here that's present, but this is our core team of consultants, and we're missing some people on there because we have people joining our team all the time, but that's our core team. So if you are an existing client, you probably recognize most of the people there as we're supporting you through the transition. So a little bit about myself. I just have a really fun time running PACE. We just do really innovative things, engaging frontline staff to really help your organization grow. And I'm very proud to be part of PACE. I'll just move it on to Bruce.
Well, I'm with Pioneer Manor, a long-term care home, and I basically get tasked with projects that nobody else falls under their category of what needs to get done. And one of them is trying to improve different aspects of what we do at Pioneer Manor. So
that's awesome.
And I have the fortune of running StaffStat, which is web-based automation for shift filling. We are working with quite a few organizations, and we get to get great response and great feedback from the people who are using the software. So it's nice to be from Sudbury and launching a software company out of the north and really seeing it work.
Yeah. And it's a strong software company out of the north going all the way around the world, because the application really is in pretty much any sector. So where PACE is located, we're located everywhere. So some of you know I was visiting Hearst yesterday, Kapuskasing the day before, so we pretty much work wherever you want us to work. Out of our offices are in Sudbury, North Bay, and Timmins. So that's where we have base offices. We're now expanding to Ottawa and Toronto shortly. That's our training and consulting practice. Those are some of the clients that we have and the companies that we work with. And this is sort of some of the awards that we've helped people achieve in terms of recognizing time savings and cost savings and really improving care for clients. In this particular news release that you see it's really about a parenting program waitlist that Roxanne was able to eliminate by using some of the methods that Bruce is going to talk about in his particular presentation. So before I get into the details, I just want to sort of tell you how the presentation is structured. I just want to understand, I think we have a poll right here. So I'm just going to ask the audience quickly to see what your level of improvement is with lean and quality improvement initiatives. Is it live? Is the poll? Yeah, the poll is live. Okay. And we just have a really, really amazingly efficient webinar coordinator here, Joanna. so I'm like, I'm not used to doing everything on my own. So we're just looking to see what level of training people have with quality improvement initiatives. And based on that, I'll either go really slow or really fast through my portion of the presentation. So that's the purpose of doing the poll. So how the presentation is structured is I'll do a little bit of sort of giving you an understanding of what lean is and sort of what the productivity leader training is about. Bruce will do an overview of his project, and within Bruce's project, he's used a software called StaffStat, and that's why Mel is here. And StaffStat, there's the process side of things and there's a technology side of things. When you do process improvements, yes, you can certainly get a bang for your buck. But when you add technology on there, it really speeds up the improvement that you can make, right? So getting both of them are key, and having products like StaffStat is definitely key to making significant improvements when you're talking about really recognizing savings. So Oh, what did I do there? Technical difficulties. All right, so the return on investment on our training is significant. It's 5 times in the human services sector, 20 times in the mining manufacturing sector. I see you guys are all sort of split 33, 33, 33 in terms of your level of expertise. So I'm gonna do a balance of how quickly I go through this particular presentation. The training itself is funded by the Canada Ontario Job Grant, so there's about $10,000 per employee available in training costs. So it costs you like maybe 30% of, so $10,000 per employee up to 70%. So 70% of it is covered, and you only have to pay about 30% in terms of your training costs. And really, at the end of the day, very simply put, what lean actually is nothing more than eliminating steps in the process. That's really what lean is about. It's not about anything more magical than that, and it's not common sense. It's only common sense after you understand the practices and go, of course it's common sense. So for Bruce here, it's common sense because he has his green belt. But for folks who have not gone through the training, it's not common sense. And the reason I say that is because if it was, everybody would be really, really lean. And if you have few people in your organization, that's not what I'm talking about. You're not lean. It's just, you may be, but that's not the lean that I'm referring to. So what we do is when you eliminate some steps in your process, you can do more with the same amount of resources. So you can delight your customers more. You can do, you have this, we essentially give you a workforce that is trained in your organization, that knows about everything that you do, and that you can just reapply them to do more for your customers at the end of the day. And that's what lean helps you do. It really engages your frontline staff in making changes possible, and helps you do more with the same. So basically, the training that we provide is basically structured in like a 3-day in-class training, and then there is a 1 to 2 month project execution phase in which we do some coaching calls and stuff, and then we come back and we do a 2-day follow-up with you guys. And the green belt training requires dedication. You absolutely need to complete a project. It's definitely not for the faint of the heart. I'm not trying to turn you off our training or anything, but it requires that dedication. Like, we'll take your money, but we want you to complete the project. So, so really, but this actually gives, the return on investment is directly tied to the project completion, right? If you do a human services project, you have a 5 times return on investment. If you do a mining industrial one, and for those of you who were at our last webinar, saw that there's a pretty crazy return on investment. So Christine here, she saved about $330,000. Collectively, they saved about $700,000, and this is Atlas Copco. And so the reason I have Atlas Copco up here is excellence is the new normal. So if you go to Atlas Copco operations, and actually yesterday I just finished a Gemba walk at the Hearst Hospital, and a Gemba walk is actually going out into the workplace and sort of looking at the way things are done and what the culture of the organization is. And when I finished the Gemba walk at Hearst, it reminded me of Atlas Copco because they are already doing really well. So they have a very clean hospital. I love their long-term care home. Like, they have pictures of the residents outside. They have just, their OB units. All their units are like really, really nice, clean. The staff are friendly. They already have some really good visual management. So when you think about organizations like that, you might say, well, why? And if you go to Atlas Copco operations, you look at their operations and they're really clean, spick and span, like shiny. They're a manufacturing facility and very, very high-class manufacturing facility. The truth of the matter is, you can always be better, right? So a lot of companies that we work with are companies that are already doing quite well and want to be better, right? So that's really, excellence is the new normal. That's where you're going. So what's unique about our training is it's really not boring. If you know us, you know we're not boring. There's a lot of fun stuff. So we have a lot of Lego Serious Play integration. We have a lot of hands-on activities that apply the concepts that you're learning right away. So that's That's what's unique about our training. You have access to a bigger learning community of coaches, and you have access to us online. So on the left, you can see all the training sessions that people have gone through. So currently we have about, I think it's about 100, but in the next few weeks, we're training about 500 more people within the next 3 weeks. So we're going to have a really big community of individuals online. And, you know, just like Bruce, there's a few other people that have achieved different value for their clients through this project. And this is the St. Joseph's Continuing Care Center, Gail and Josanne. Actually, I think, what did they actually reduced the time, reduced the delay between the identification of bed vacancy and the bed fulfillment notice. So it's basically getting patients into beds faster is what they helped do. And with that, I will hand it off to Bruce to see if Bruce wants to take it away from here.
Yeah, so what happened was at Pioneer Manor Long-Term Care, we have about 200 shifts total a day that have to be filled, and 100 of those are healthcare aides.
Should you be updating the screen? I don't know.
Yeah, you should go like this. There you go. Sorry about that, Bruce. I will deal with the screen for you. How about that?
That would be very nice.
Okay,
Thank
sounds good. I will do that for you. Go ahead.
So what was happening? We get somewhere between 10 and 15 calls a day for sick calls that we had to fill, and that was taking 8 to 10 hours a day to fill them, and we were running short of full staffing quite consistently by close to 5% overall per day, and with our healthcare aides, it was 4.7% in 2015. So we had to find a better way and a faster way that we could contact our staff, because when we looked into the math and after we'd done some Gemble walking, it was taking 20 people. We'd had to contact 20 people 1.5 times with cell phone and regular phone to fill one shift. So if you say 90 seconds per phone call to look up the number, dial it, wait for it to ring, leave a message, that adds up at the end of the day for to be a very large amount of time spent for staffing on the phone. And we were not filling the shifts, and we weren't getting to some of the other groups that were, for healthcare aides and nutritional aides that, first thing in the morning. So we had to find a better way. And we started to investigate solutions on that as to how could we trim down the timelines. And we investigated a couple of different softwares, and we went with StaffStat. And StaffStat has allowed us to totally change the way we contact our staff, whereby we can contact every single staff that's available, and it takes us about 5 minutes. So if you have 130 part-time healthcare aides, there might be on any given day 40 or 30 or 40 that are available, and it takes us 5 minutes, and we've contacted them all. So we're not waiting to find out. Once they've returned, then we can say who gets the shift based on the seniority protocols that we have. The reason I like the green belt training that I've taken, it basically, we knew in our gut there was a problem. We didn't know really what it was. We didn't really know how to get down to the nitty gritty of it and figure out what we wanted to change. And what the green belt gives you, the training, is the structured way to analyze the situation and break it down into finite parts that you can actually work on improvements. And the phraseology of how do you eat an elephant? It's one bite at a time. And one of the things that gets to a lot of people, I know particularly in bureaucracies like the government, is everything looks like a mountain in front of you that you're trying to attack, and you sometimes make the mistake of trying to attack the whole mountain instead of just starting with little wee pieces that you can actually make a change to. And that's what the green belt really has helped me do, is break it down, and then you can make changes on that one little piece and see if it works, and if it doesn't, do something different and make that change and then move on to another little piece.
Yeah, and the benefit of that is also, correct me if I'm wrong, Bruce, is also so you know what change resulted in what impact, right?
Right. So like you're not just making 75 changes all at once because you're attacking the mountain and you're really not sure what's working. All you know is something has changed, so you're happy. This way you have a little better feel, or a lot better feel, for that finite little change has made X amount of improvement.
Excellent. So what were some of your things that you would do differently? So Delta is a jargon that we like to use here at PACE. And Delta, the reason we call it Delta is because it's a change. So the sign Delta is actually the sign for change from what you would have already done. So when we implement projects, there's always something that we would have done differently, right, Bruce? So what would we have done differently if we had
Well, the thing that we did that I would say that I would do differently the next time I rolled out anything to 500 unionized staff is I would break it down into much smaller groups than everybody at once. We tested it with the non-union in a, we'll say, fake environment or simulated environment, and everything seemed to be fine. But that was after a lot of conversations, explanations, showing them how things worked. And, they understood it. But when you're rolling it out to 500 unionized staff with, a couple of memos and a couple of test shifts, we didn't get quite the same level of interaction that we would have liked. The groups that we had an opportunity to sit with that were, predominantly the day shift or afternoon shifts, where we could actually sit down and have a meeting and show them and demonstrate it, we had extremely good uptake right off the bat. But we failed to easily convince the people that we didn't have that time with. And that was the other thing, is that we have to figure out a better way to communicate with the 24/7 shift work people that are not there during the normal business day. That's where there was a real slow uptake on the process, because they were basically, you've issued memos and you've issued tests, but are they reading it and do they understand it? Because you don't have that interaction feedback. So,
and those are all change management things that, once you do a few changes, you're like, yeah, maybe we could have done that differently. There's always value, right?
Yeah.
To learning from the challenges that you go through. So we have a problem statement here, and just to give everybody some context, we always start our project with a problem statement. Yes, you guys are all positive thinkers out there, and I've been to management school, and no, there are no problems in the world. There are only opportunities. Let me tell you, when there's a problem, you have to call it a problem and then deal with it as a problem, right? So that's why we call it a problem statement. Tell us about your problem statement, Bruce.
well, basically, as I indicated, our problem statement is we were taking too long to fill the open shifts. And when you take too long, that leads to working short, which impacts the care the residents receive. And working short also then leads to injuries and modified work of the people that are there, which leads to increased WSIB claims and a lower staff morale.
There you go.
Now, I will say it took me about 4 or 5 days of massaging the problem statement to get it down to that level, because we started with a much bigger, broader statement, and it, until you start using the tools and breaking things down, you start out with a huge picture till you narrow it down. And that's what the training does give you, is that how do you put it into the funnel and come out with something a little bit more manageable?
Exactly, because if you look at Bruce's problem, there he's really referring to the actual impacts of the problem. Because a lot of people will say, if I ask, what's your problem? They'll say, problem is we can't find enough people to fill shifts. And really, that's a very generic problem. So it's really massaging that down. So tell us about your background, current conditions.
Well, when we started this project, we looked at April and May of 2014 statistics at the time, and we were averaging somewhere between 10 and 15 sick calls a day, with 20 contacts to fill one shift. But that's 20 people. So it was really 30 contact points at an average of 90 seconds per contact point. And the schedulers were spending 8 to 10 hours a day making those calls, and they were only basically able to deal with whatever happened today. They were never able to get ahead of, we know so-and-so went off sick, or is on modified, or is on mat leave, or has left the employment of the organization, and we were not getting ahead of the game with those on those calls, because we didn't have time.
Yep. So who are the clients impacted by it?
Well, obviously, all of our unionized floor staff, the scheduling department staff, our supervisors, and a little bit in our IT department. But the biggest impact is the residents, because we exist to take care of 433 residents. And if we don't have the staff on the floor to do that, then their care suffers.
Absolutely. So here's a little, just so people know the image that they're looking at this is sort of what Bruce did, like the tools that he used. That's called a root cause analysis or a fishbone diagram. And like Bruce said, once you understand your problem, then you can go into sort of identifying in detail, right? What are the contributors to that problem?
Yeah.
And the three things I think that are highlighted here, Bruce, are the ones that were so any problem that you have can have a whole bunch of root causes. And I think that's what you guys did, right? Focusing on three specific root causes and tried to solve them. And that's what the staff stat solution comes in, right?
Yeah, basically our big picture mountain was working short. And then once you break it down, one part of that was how long it took to make the phone calls.
Yeah.
So that's after you've gone through and done the Gemba walk, sat with how things are working, you map it all out. Then you've done the process diagram and you've done your fishbone diagram. Now you can break it down into that small piece of, okay, here's something I can work on. Because the working short is just way too big to say, okay, let's work on working short.
Yeah. Now you know that.
Yeah.
We now know that working short is too big of a problem statement to tackle. Let's tackle it one elephant at a time. So one bite of the elephant. Sorry, not one elephant. One elephant's too big, I think. One bite at a time. That's how we eat an elephant.
I've been accused of having a very large mouth, and I couldn't even eat the elephant in one bite.
So with that, we'll introduce Mel from Staff Stat, and sort of Mel, if you want to sort of drive that, you certainly can. And tell us about Staff Stat, Mel. Tell us how you came and rescued our problem there.
So we had a chance encounter with Bruce actually when we were coming into Pioneer Manor just to introduce the solution and let them know what it is that we're doing. And what Staff Stat is a way to communicate with staff. We've got 4 different methods of communication. We can send out emails, texts. We also developed an app, which was early last year where we launched it. And we also send out automated telephone calls to landlines and cell phones. So the scheduler simply plugs in the information. They send it off. The staff that should be notified based on designation and site training receive the notification, and then they respond directly back to the system.
So hold on, let me understand this. So I was talking to someone, I think at a hospital yesterday, and I said, and it was a scheduler, and she said, it takes me 2 hours to make phone calls. Right? So instead of the 2 hours on phone calls, she can just go on a computer system or something, and then it just sends something to everyone all at once?
Yes. So the concept with Staff Stat is not to change the assignment process. We're changing out the call out process. So what we're doing is reaching out to staff in mass, allowing them, and every organization does it differently. But if I look at somebody like Pioneer Manor, maybe they're allotting 30 minutes or a 2-hour period for staff to respond to a specific shift, depending on when the shift will be taking place. And then from there, they can receive an alert now through the system, letting them know, okay, it's been 2 hours, you're ready to assign your shift. And then they click on the link, brings them to the shift. And based on the list of people who responded, they assign according to the collective agreement.
Wow, that's pretty impressive.
So that is pretty much how Staff Stat works in a nutshell. We're currently working with, again, we're from Northern Ontario. We were created from a healthcare staffing agency here local. Our intention wasn't originally to go to the market, but when different homes had a taste of what it was that we were doing, they were interested. So we went ahead and launched it to the market. So we're filling on average about 195 shifts per organization per month, which is a pretty good number. And yeah, so essentially it's having great impact, and the numbers that we're seeing on return, the conversations that we're having with people in terms of the positive impact it's having. And there's always going to be that little first timeline where people have to kind of learn that there's a change and we're going to be doing something a little bit differently. I'm sure Bruce can speak to that too. But once the buy-in happens and the staff start responding, you really start seeing a lot of positivity rolling through the organization.
So like 195 shifts per company, like per organization per month. That's saving at least 4 phone calls, right? You would it would be multiple phone calls per shift.
Well, per shift, the average, and this is thanks to some of the research Bruce did pre.
Yeah.
But one shift takes up to 20 calls, so it's an average of reaching 20 people at 1.5 points of contact. So some people you have to reach 2 ways. They've got a cell phone, they've got a home phone.
Yeah.
And not to mention, I mean, if you call a phone and then there's a voicemail and I got to listen to this message, then I'm going to leave it and only to hear the voicemail box is full.
Yeah.
So you've wasted that entire time for nothing. So StaffStat's taking care of that time, even beyond the shifts that we're filling, and that's only the shifts we're filling. That's not the shifts that are posted on the system. That's what we're filling. So even those shifts that are all posted, that's where the real savings, to me, I kind of look at it that way. And I'm sure some of the organizations do too, because the 195 that are filled, that's great. But the other, let's say 50, 60, 80, or whatever that number is of shifts that aren't filled, that's all time that your scheduler could have been doing something else, or that anybody could have been doing something else. If your charge nurse is now left to doing this task, it's ridiculous to have your highest paid body in the house or in the home making calls to try to fill a shift for tomorrow morning.
Wow.
So they have access to the system too.
That's impressive.
Did I skip ahead, Bruce? Sorry.
Nope. So after we introduced StaffStat and we smoothed out the people understanding how it worked, which took a little longer than we anticipated because of the delta that I recognized earlier on. We've found that we're saving approximately 25 to 30% of the scheduler's time on the same number of shifts that they would be trying to fill. But what we have really noticed, as Mel was alluding to, is that we are trying to fill 50% more shifts than we were in the past. And I believe last month we posted in excess of 1,200 shifts for the month of December. Or was it January? I'm not sure which, but it was a very large number. Now, some of those are the same shift multiple times, which we never had an opportunity to do before. A week in advance, 3 days in advance, the day of, for full day of overtime, for half a day of overtime. And we've done everything we possibly can to fill that shift, which has also lowered the comments from staff of, how come that shift is empty? How come it's running short? Because they know everybody's been contacted to fill the shift. So we've lowered some of that, and that has helped out tremendously. One of the big things that we've really noticed that has helped us tremendously is if we give the staff more than 24 hours notice of when a shift is available to be filled, that's that getting ahead of the game. We have a very, very high fill rate in comparison to the same day. We're basically filling 3 times as many shifts if we give them more than 24 hours notice. So, and before we went to StaffStat, we had very little time to get to the shifts that were coming up in the near future.
Excellent. Do you want to go to the next slide there? We do have some questions come up, so we haven't forgotten about your questions. We will get to them just as soon as Bruce has done his piece.
What all of this has led to, and that's the biggest part of this, is that we're filling 2.5 to 3 times more shifts per month, or we're trying to fill 2.5 to 3 times more shifts per month, some of them multiple times. But the big impact is we're working short far less often from 2015 to 2016. In our healthcare aides, which is a PSW in a lot of organizations, we went from an average of 4.7% of working short in 2015 to 1.7% in 2016. That's a huge improvement. And overall, we went from 5.2% down to 3.2% for the whole RNs, RPNs, and healthcare aides.
Wow.
So that has helped out tremendously in resident care. We have more bodies working than we did in the past.
That's impressive. That's pretty cool. And that's how it impacted resident care.
That's the biggest, and that's what we're all about. Like that's what a long-term care facility is all about. It's taking care of the 433 residents that now call Pioneer Manor home, and we need the staff there to do it, and that's what we're trying to achieve.
Mm-hmm. So that's just a date for our upcoming training we have coming up.
Sorry.
Did we miss a slide?
No, I think I skipped.
Okay, that's all right. No worries. And then now is a question and answer session. So Melanie, there's a question for StaffStat, And it says, does StaffStat also have a scheduling module?
So we do not have a scheduling module. That's intentional for us at this point in time. I can say that we're a separate silo so that we don't have to call down the list in order and then wait 1 minute in between every person that we call, abiding by seniority. So again, we're all about calling out in mass and not being affiliated with that scheduling software and trying to figure out, okay, who do I call, who do I not call? We're just about calling in mass and allowing staff to make themselves available at will.
Cool. And so then that way, like a person that understands the union legislation can just look at that list and then make the decision on which staff is appropriate to take that shift. Is that how it works?
So, and that's not tied into staff stats. So that component is still up to the scheduler to determine, okay, based on this list of respondents, who should rightfully be assigned this shift.
Perfect. So I have another question, and the question says, what percentage of staff is represented by sick calls, and is it higher than normal? And it's a good question, right? I don't know if you guys actually keep stats on that. So how many number of calls that come in, what percentage of it is sick calls, and is it higher than normal? I don't know what normal is, Dave. So depends on the answer to that. But I will answer with a plug, really, because at the National Health not at the National Health Leadership Conference, we're presenting at a human resources conference, a provincial conference in Nova Scotia and PEI, and the topic of that particular presentation is about reducing sick calls, actually. So, and how to improve, various projects that we've seen that they're successfully able to reduce sick call time. But I don't think StaffStat keeps stats on those types of.
Well, we do. We track when shifts are posted only with 24 hours or less notice. So to us, that's considered an urgent last minute request versus how many shifts are posted with advance notice.
Yeah.
Like Bruce was saying, the fact that homes are able to post it well in advance means that on that day, they can just focus on, okay, 3 people called in sick, let's deal with these people. Whereas before it was scrambling to deal with that and the upcoming, somebody else took a day off today and we didn't get that covered in time. Or I have somebody in laundry who called in sick, but I really need to get a healthcare aide in here first. So now the difference is that you're able to deal with all of the sick calls at once.
Yeah.
I actually had a conversation yesterday with one of the schedulers over at a hospital in Northern Ontario. And what she told me was she was actually told by a couple of staff now that when they see the phone go off, even though they were considering calling in sick, they feel like I shouldn't call in sick because I know they're already one down.
Yeah.
So they get the notification too.
Yeah.
So it kind of, it triggers them to not, so they've seen their sick calls actually go down. So I don't know if that'd be across the board, but that's based on a conversation that we actually had yesterday.
It'd be interesting to look at your stats,
for sure,
and see how it goes. And another question about, all right. So with there's a question for Bruce. Are your sick calls higher than you might expect from a comparable work environment? So is it a long-term care home problem? Are you average for long-term care homes?
Well, I would say we're probably average to slightly above average because you have to factor in a lot of different issues when you start doing that comparison. One, we're 433 beds, so we have a lot of staff. That's one issue. Our union contract allows for 18 sick calls, 18 sick days per year. So that's another issue. And given my conversations with other long-term care facilities, it's the standard problem across the industry. At what level is normal or what is to be expected? I don't know that we have a handle on that to a finite number. The other part of it is in long-term care and healthcare in general, there's also rules and regulations from the ministry that if you have any issue of a potential infectious, whether it be enteric or Norwalk virus, you are obligated to stay home as a staff member till you're 48 hours symptom free. So, there is issues like that. If you're in the middle of an outbreak, which we were in 2016, we had 3 of them, I believe. You do have an issue with sick time. I think it added up to close to 5,000 hours that was related to the outbreaks that we had. So that's a difficulty.
That's great. They say good answer. Thanks, Bruce. So we have a question for staff stat. But staff stat are the responses gathered and sorted based on any predetermined factors, i.e. alphabetically or by department.
By timestamp is how they are sorted.
Okay.
So based on when staff respond, regardless of if their last name starts with an A or a Z, and regardless of where they sit in terms of hours worked so far, anything along those lines, because it's not tied into scheduling software, we've had it basically just list individuals based on when they responded to the shift.
Okay, sounds good. So if there's two people that are on the same,
but it'll only be, I'll answer part of this for
Yeah.
Melanie, because I think I'm reading something into the question. But you only send it to the group that you want to send it to. At Pioneer Manor, we have 18 different groups. So you split everybody full and part-time and then by designation. So you're only sending it to your part-time healthcare aides. You're not sending it to all your staff at once. So that would be how it's already sorted by who got sent it.
Thanks, Bruce.
It's better for an answer to come from a user, right? Rather than us coming up with the answers. Well, I think that's it for the questions. If any more questions come through, we'll certainly definitely get back to you. But oh yes, and here's the mistake I make every time is I don't show you our contact information right there. So here's our contact information. I think we forgot to show Mel's Mel's website. Oh, you did? Okay, so I think, oh, we did show it. So we were showing it, Mel.
Okay.
Okay, it was there. Joanna had taken care of.
I believe it if Joanna was on it.
So thank you very much. Hold on, there's another question. When responses are received, are you able to sort the data, i.e. by seniority? Do you want to call or email Natasha directly?
I will definitely do that. Natasha, I'll send you an email after the webinar so that I can answer any of your additional questions.
And she'll do a personal demo for you too. There you go. Awesome. Thanks, Natasha. And thanks, Mel. Thank you, Bruce.
You're
welcome. Thank you.
Yeah, we appreciate it. So we're going to hopefully be able to end this webinar okay. So